In this video, you'll discover some of the early yet surprising warning signs to help you determine if your heart is well. Hi Wellness Warrior, I'm Dr. Zyrowski, and the fact is cardiovascular disease is dangerous. It's the #1 thing that kills people prematurely. You hear of people all the time in their 40s and their 50s, and it's not full-on cardiovascular disease, it's heart attacks and strokes. It's high blood pressure and heart-related illnesses. So our heart is our lifeline. We have to make sure that we're taking care of it. So in this video, we're going to talk about the risk factors that contribute to heart-related problems, the contributing lifestyle factors, and then also the signs and symptoms, and most importantly, at the end, we'll talk about what to do about this. So first, let's go ahead and dive into the signs and symptoms. And we're going to start off with feeling extremely tired. If you're somebody who is extremely tired all the time, and there's no reason for it, right? And you're in the 40s and the 50s, you're in that age range where you're like, I'm a little bit worried about this, then you have to take this seriously because it could be a cardiovascular related issue. And the reason for this is because your blood is not pumping oxygen efficiently throughout your body, which is going to help energize it. Next on our list is going to be swollen feet. If you press on your feet and you get a dent in your foot, this is referred to as pitting edema. So you press down, pull your finger away. If that spot where you press remains, that is a sign that you have swelling in your feet, and this is a cardiovascular related issue to where your blood is not pumping efficiently and is pooling in your feet. Now, this doesn't just happen though. Like, you're gonna realize that there's gonna be some other problems associated with this. It's gonna have contributing risk factors. Let's take a look at a few of them. First is obesity. And you know if this is an issue for you, and I really want to empower you to take control of your health. Start losing weight, start exercising, start eating right, start reversing this. Next is going to be cholesterol. You went to the doctors, they said high LDLs, okay? High blood pressure, depression, clinical depression, insulin resistance, and type 2 diabetes, okay? So if you're falling into this category where you have some of these risk factors, then this is where you go, these symptoms right here, I got to take a little bit more seriously because step 1, I'm falling in the risk factor category. Now I got some of these signs, right? Now let's take a look at our third sign and symptom, and this is going to be dizziness or lightheadedness. And the reason for this is because there's arterial blockage. We have to make sure that if this is happening to us and there's no other explanation, we're taking it seriously and we're making sure that we go and get a checkup, see how our heart's doing, get some blood drawn, get some cardiovascular markers looked at, right? Now let's take a look at our fourth, and that's going to be shortness of breath. Now the reason that this is happening is because you're getting a fluid buildup in the left ventricle. Okay, and this is probably because of a faulty valve issue. So we want to make sure if you're getting shortness of breath unexplained, then we're looking at cardiovascular related problems seriously. And once again, this is like you're somebody maybe who exercises, but yet you walk up the stairs and you're totally winded. You're somebody who walks to the kitchen in your home and you're like, let me sit down for a minute, right? It's unexplained. It just doesn't make sense. Now let's take a look at the fifth sign and symptom, and that's going to be anxiety and depression. Now, we all understand that a lot of people have anxiety and depression. They don't have cardiovascular issues. But if it's associated with sweating and nausea, then we want to take it a little bit more seriously. And we also want to look at why these would be happening, right? Because we always want to get to the root cause. You know, I don't believe in covering things up with a chemical, right? Taking a pill to cover up your problems. I believe in actually getting to the root cause and fixing them. What are some of the contributing factors to some of these risk factors and signs and symptoms we just talked about? First is a sedentary lifestyle. This is something very common today. If you're finding yourself sitting a lot throughout the day, maybe all day, you may be someone who gets in your car, sits at the office, goes home, eats dinner, sits on the couch, watches TV. Well, we have to make sure that we're moving. And I have patients tell me all the time, they're like, Dr. Zyrowski, I exercise 30 minutes a day. I go for a walk. And it's like, I know, but the other 13 hours you're sitting doing nothing, right? I mean, you're working, but you're sitting. There's no movement. It is important to understand that exercise is a genetic requirement for our bodies. If we don't exercise, we have an exercise or movement deficiency, just like a vitamin deficiency, a micronutrient deficiency. We have to be moving. Now we got to make sure we're removing the trans fats. These are very common packaged foods, pastries, fried foods, all those different junk foods out there are loaded with trans fats. And this is basically an artificially made fat that is designed to stabilize food so it can stay on the shelf for long periods of time. We also want to avoid hydrogenated oils and seed oils that are going to raise our omega-6 levels and cause more inflammation in the body. Next, avoid sugar, okay? We know what the sugar is all about. on average, you're probably consuming around 100, 125 pounds of sugar per year. Well, not you, of course, but the other people who don't know this information. We have to make sure we're avoiding it so that we're not destroying our heart health. And remember, when we have different health issues like type 2 diabetes or obesity, depression, there's collateral damage involved. It doesn't just stay in that one organ system or that one physiological mechanism. Oh no, it spreads throughout the entire body and starts causing havoc. There's always collateral damage, so remember that. So what do we do about this? Okay, this is the most important part. Is what we have to do is we have to obviously start taking action. If we're sedentary, start moving, start exercising. Your heart is a muscle. And just like the rest of your muscles, if you want them to be healthy, you have to work them. And if you want them to grow, you have to work them. If you want your heart to actually be strong, you have to work it. We want to avoid the fats. We want to cut out the sugar, clean up the diet. We want to work on cutting out carbs if you fall into the category of type 2 diabetes or insulin resistance. Cut out the sugar, go sugar-free. Make sure if you're fighting depression, you're getting help for that. You're doing yoga, you're doing box breathing. You are making sure that you are doing everything you can to get your mind right. And then from here, take care of obesity and cholesterol through exercise and proper dietary intake. Now let's talk about some other things you can do in the way of like supplementation, okay? Because sometimes people go, well, what can I do at home? Do the stuff I just mentioned. But yet when I work with people clinically, we look at what we can do on top of that, like furthering the support that we're gonna get. Now, what I like to do is use things like CoQ10 for heart health. I like to use omega-3s to help lower inflammation, improve your lipid profile, helps lower your blood pressure. So many amazing things happen by using omega-3s for your heart health. I like using magnesium. Magnesium is very good. It's very good at calming the muscles and helping the muscles stay strong. So I like using magnesium for heart health. I'm a huge fan of magnesium. I use it daily. And then I also like to use curcumin. Curcumin is probably one of the most powerful anti-inflammatory herbs on this planet. So using curcumin in order to help pull down inflammation and get your heart healthy. So those are some of the top things you can do, and I'll put links to anything I have resources to in the description below. Now, if you enjoyed this video, I think you'll really like this video next on your health journey.